Alberta's response to the coronavirus continues to go very well. The province-wide total daily numbers of reported cases peaked at 336 on April the 23rd and has been declining ever since. The growth curve has successfully been flattened in most of Alberta. We must, however, remain careful. We must continue to take all the small daily precautions to keep the spread of the infection low and to protect the most vulnerable amongst us. This includes all the things you've heard 1,000 times: washing our hands frequently and thoroughly, sanitizing frequently touched surfaces, wearing face coverings in crowded places, respecting physical distancing, and staying home if you're feeling sick. Having said that, new cases are still appearing every day, with the hardest hit communities being parts of Calgary and Brooks, which together account for 3/4 of Alberta's current COVID-19 cases and hospitalizations. New cases will continue to appear even as we keep the infection rate low and well within the capacity of our hospitals, especially the intensive care units. The strongest measure of our success in containing the virus continues to be Alberta's low hospitalization and ICU admission rates. The probable projection in the April 28th modeling projected that hospitalizations would peak at 600 COVID patients in mid-May, while ICU admissions were expected to peak around 190 at the same time. Instead, combined hospitalization and ICU admissions so far peaked at 96 on April the 30th and have been falling since. Today, there are 70 Albertans being treated for COVID-19 in hospitals and only 11 in intensive care. The most encouraging news of all is the surging number of recovered cases. The number of recoveries has surpassed the number of active cases, and they did so at the beginning of May, and the gap between those two numbers has been growing steadily, and that's very good news. We now have more than 5,000 recovered cases compared to 1,100 active confirmed cases in the province. So recovered cases now outnumber active cases by about 4 times. We have seen nearly full recoveries from some of our largest outbreaks, including at the Cargill and JBS packing plants. While the ratio of active to recovered cases in Calgary and Brooks is lagging that of the rest of the province for now, Edmonton is currently recording only 53 active cases against well over 400 who have recovered. And large parts of central Alberta are reporting almost no active cases whatsoever. All of these numbers add up to a very successful stand so far against COVID-19 in Alberta. This is in thanks in part to the great efforts of our public health professionals in delivering one of the world's most effective systems of COVID-19 testing, tracking, and tracing. But above all, these results reflect the discipline shown and the sacrifices made by millions of Albertans, all of it to protect the most vulnerable amongst us, like the elderly and those with underlying health problems. So today, I am pleased to announce that thanks to your efforts, we are proceeding with Stage 1 of Alberta's Relaunch strategy. On the advice of our public health officials, we will be taking a gradual regional approach to reopening for certain activities that require greater physical proximity. Dr. Hinshaw has flagged 2 specific areas, Calgary and Brooks, where we continue to see a disproportionate number of cases. Together, they account for 3/4 of our current cases of COVID-19 and hospitalizations. As such, we've accepted the Chief Medical Officer's advice to have a slightly slower, phased relaunch in those 2 communities. This is consistent with the regional approach that we said might be required when we first announced our relaunch plan a couple of weeks ago. So starting tomorrow, a wide array of businesses and facilities will be able to reopen in most of Alberta, including retail businesses like clothing, furniture and bookstores, along with all vendors at farmers markets, hairstyling and barbershops, museums and art galleries, more scheduled surgeries, dental procedures, physiotherapy, chiropractic, optometry, and similar services, and daycares and out-of-school care and day camps, including summer school with limits on occupancy. Restaurants, cafes, pubs, and bars with seating at 50% of their legal capacity. Post-secondary institutions will have more flexibility for course delivery, including in-person or in combination with online learning. And places of worship may reopen their doors, including for funerals, under strict guidelines. The lifting of these restrictions is in addition to those announced at the beginning of the month, which included the reopening of golf courses, boat launches, and private and municipal parks, sports fields, outdoor courts, as well as playgrounds, and the resumption of scheduled non-urgent surgeries, along with services provided by some regulated health professions as long as they follow approved guidelines from their professional colleges, like the dentists. And the reopening of provincial campgrounds with some restrictions, including for overnight camping at some parks starting June the 1st and most others by June the 15th. In Calgary and Brooks, these initial restrictions were also lifted and will remain lifted, but the complete Stage 1 relaunch will be phased in over a 2-week period. Starting tomorrow, Calgary and Brooks will join the rest of the province, allowing the following to operate under public health guidelines. Retail businesses like clothing, furniture, and bookstores, all vendors at farmers markets, museums and art galleries, as well as daycares and out-of-school care with limits on occupancy. Then, starting 11 days from now, starting May 25th, hairstyling and barber shops will be able to reopen, along with cafes, restaurants, pubs, and bars at 50% capacity. And then finally, on June the 1st, the remainder of the Stage 1 reopenings may occur in Calgary and Brooks, including day camps, including summer school with limits on occupancy, post-secondary institutions for in-person or combined online course delivery, and places of worship, including funerals, again, under the guidelines. These businesses and organizations will have a little extra time to prepare for safe reopening, while our public health experts continue to monitor the data in those communities. Detailed information and guidance for businesses, nonprofit groups, municipalities, and individuals on how to safely resume all of these activities is available on the Alberta Biz Connect website. All of the reopening activities will still be subject to the legally enforceable orders of the Chief Medical Officer, including, in most settings, the 2-meter physical distancing and 15-person social gathering restrictions. Now, I know that many folks in Calgary and Brooks will be disappointed that reopening will take a little bit longer for things like restaurants, hair salons, and limited worship services. But we didn't take this decision lightly. Our fight against COVID is going in the right direction across the province and in Calgary and Brooks. And barring an unforeseen spike in new cases or hospitalizations, we should be able to stick to this slightly more gradual schedule. But Dr. Hinshaw and her colleagues are concerned that we continue to see significantly more cases of community transmission with unknown sources in Calgary and Brooks as compared to the rest of the province. So we are prudently giving our public health experts a little more time to monitor trends in those communities. Better to be safe than sorry. So let me be clear. No one should suggest that Calgary or Brooks are in any way unsafe. That would be wrong. The number of active cases in Calgary is only 74 per 100,000 people, compared to 29 per 100,000 people province-wide. So the risk is low for Albertans wherever they live. And we are all in this together, regardless of where we live. Like the initial decision to close some businesses and restrict some activities, the process of gradually and safely reopening them has not been an easy one. It's an evolving process that will change as we learn more about the virus and about what can be done relatively safely and under what conditions. I want to remind Albertans that our province has remained far more open than other provinces and most other jurisdictions around the world. In fact, 85% of Alberta businesses representing 96% of our province's economy and 88% of our workforce, have been allowed to stay open over the past 2 months. On top of that, we're moving more quickly to reopen before other jurisdictions, and we are doing so prudently to reduce the chance of a second spike that could force an even more damaging set of public health restrictions. So I know that for some folks, this will feel like we're moving too fast, and for others, will feel like we're moving too slowly. That's why I want to assure all Albertans that at every single step, these decisions are being informed and guided by data and by the best scientific and public health advice available. However tempting it is for Albertans in low-risk groups to relax your guard, please don't. Everyone who has symptoms of COVID-19 or who have had contact with infected people or who have returned from international travel will still be required to self-isolate. It comes down to relying, at the end of the day, on common sense and on all of us accepting personal responsibility, for managing the risks. Government can provide rules and guidance, but at the end of the day, it's the responsibility of each and every one of us to protect ourselves, our families, and the wider community. If we slack off, people in our community, and maybe people we love, will suffer. And if cases and hospitalizations spike, we'll have to reintroduce either regional or province-wide restrictions again. On the other hand, if we manage stage 1 reopening successfully, we'll be able to move sooner into stages 2 and 3 of our relaunch than would otherwise be the case, which will be vital to the future of thousands of businesses and our overall economy. Throughout each phase, there will be an evaluation and monitoring period to determine if we need to adjust restrictions up or down. We'll closely watch hospitalization and ICU rates in particular. Where hotspots and outbreaks occur, they will be closely monitored with widespread testing and tracing to manage them, as we did in High River, as we're doing right now in Brooks and Calgary. Once again, I want to encourage all Albertans to download the Alberta Trace Together app. It'll be very helpful for healthcare workers to track and isolate infections, stamp out local outbreaks if they occur, while giving us more confidence to move the future to the next stages of the relaunch. Alberta's government is doing everything within its power to curb the spread of COVID-19. The measures we have put in place are there to keep Albertans safe and to get us all across the finish line. We can see these measures are working. Albertans have demonstrated a tremendous level of personal and civic responsibility in the face of an unprecedented threat to our well-being. So congratulations to one and all for our success so far. I'm confident that we will move through the next stages of the relaunch strategy with the same unity and resilience that we've shown since day one of the pandemic. So with care and common sense, we will move forward together.